He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia. Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.
Thanks for joining us, folks. It's Stay Off My Operating Table with Dr. Philip Ovadia, and we are joined today by someone who's doing something that I'm crazy about, and it's not his first time here, Andy Schoonover with CrowdHealth. Phil, I was so excited when I saw you'd invited him back, just because I really like Andy and I really like what he's doing, and you're doing some new stuff. But first, for those people who were unwise enough to not hear your first interview with us, give us the quick elevator pitch about what you're doing, and then we'll go into all this stuff.
Would be happy to. I'll give you a little context for the company because I think it's good to have a little bit of the backstory. But this is my second healthcare company, and I sold my first one. And after I sold it, given that most of us get our health insurance through our employer, I didn't have health insurance, and so I was looking at all the options and kind of ignorantly went to healthcare.gov and got a marketplace plan off of that. And it was, I think, $1,100 or $1,200 for me, my wife, and my two girls. And I joke it worked until I had to use it. My little one was one at the time, and she was having recurring ear infections. And so we went to the pediatrician. He's like, oh yeah, she's got a hole in her eardrum. And so you need to go to the ear, nose, and throat doc. So we went to the ear, nose, and throat doc, and she's like, yeah, no problem. I'm going to put tubes in her ears, get some of that fluid out of there. And so we went to the only place in town that was in network to do it and got that. A few weeks later, got a bill in the mail, and it was $8,000 for a 15-minute procedure. I was just like, holy crap, $8,000 for 15 minutes. I think we were at the location for a total of an hour. But I was like, okay, this is what health insurance is for. This is the whole point. And little did I know, a few weeks after that, my health insurance company was going to send me a note via snail mail, funny enough, and said it was medically unnecessary, so they weren't going to pay for it. And so I went through multiple rounds of appeals, and they still at the very end was like, nope, we're not paying for it. So I had to stroke an $8,000 check to pay for this procedure. And it was from that I just realized that I was like, man, like I'm paying for something that I'm not going to use. And when I want to use it, they're not going to let me use it. And so I called the health insurance plan and I said, I quit, and I became uninsured. And so I have been uninsured since 2020. And have kind of over that first year figured out, is there a viable way to operate outside of the legacy health insurance space and get my bills paid? And so I started realizing that if you pay in cash, it's way cheaper than if you buy it through insurance, buy healthcare services through insurance. You can negotiate these bills, all of these things. And ultimately, I got to a place of saying, I bet you other people would be interested in this too. Everybody hates health insurance. I haven't found one person who doesn't work for health insurance companies that loves their health insurance. And we started CrowdHealth in 2021, and we're now up to about 10,000 people who are members of our community, all funding each other's healthcare needs. And we've funded 20,000 bills over the last 3 years. Everything from little pediatric visits to, we had a guy over the summer shoot himself, 1 bullet, 5 holes. And that was approximating $1 million. I'm happy to go into that story because it's a really fun one. But it's worked incredibly well. And our members are paying about half of what you'd pay with a regular health insurance plan without the craziness of networks and explanation of benefits and all this other stuff. So it has worked incredibly well, and we're off to the races. And many thanks to you all. I've gotten amazing feedback on our last chat, and I know a lot of people signed up as a result of that. So I appreciate you all having me on again.
Yeah, definitely great. And Jack, we have to put a pin in. We definitely have to circle back to the story about shooting himself and getting 5 holes. But I wanted to, we've already had you on once, right? So we don't have to necessarily go through all the background. I want to get sort of the big question out first here. How much of what is wrong with our healthcare system today here in the US, at least, do you think we can point to insurance as the reason for it?
I mean, I think if you just look at there's a couple ways of looking at this, right? Like one is just the actual price of a procedure. And I think that the vast majority of that challenge is through health insurance. I think that there's a second component of this, which is more utilization. So utilization times price equals total cost. I mean, I think utilization also the health insurance plans play a big role of that, because once you hand over your health care to a health insurance company, you don't take as much personal responsibility, I don't think, for your own health care. And in fact, we're seeing with CrowdHealth, it's anecdotal now, but I'm seeing so many people who are, losing weight, who understand what metabolic health is. And again, thanks to you all and the message you put out there. We sent your book to, I think, 400 or 500 people in our community to talk about metabolic health. And before that, people had no idea even what metabolic health was. And so, by educating them and getting them to understand what fasting insulin is and, visceral fat and things like that, I think it makes a huge impact on long-term utilization. On the price side, I think the vast majority of it is health insurance. I think on the utilization side, or just how healthy we are, I think there's a decent chunk there. It's hard to calculate that exactly, but I do believe that the lack of personal responsibility within healthcare, given we've outsourced our health to health insurance company, plays a big role in that.
Yeah, no, that's something I, think about and talk about often, is by disconnecting people from their health, shall we say, the consequences of their health, right? What it costs them to be unhealthy. We kind of hide that. And I think, your model theoretically, and it sounds is demonstrating this, right? When you reconnect people with the cost of their poor health, they start making different choices around that.
Yeah. And I also think reconnecting them with their doctor. I think from my perspective, when have a health insurance company, an employer, the government, between you and your doctor, there's a lot of layers there that you have to get through to enable your doctor to do what, he or she needs to be done to get you better. And if you're paying them in cash or credit card or whatever at the point of care, you rip out all those middlemen. And now it is truly the medical decisions are between you and your doctor. And there's no third or fourth or fifth party that has to opine on that. And I think you just get better care that way. I think insurance companies are forcing doctors to spend, primary care doctors, 10 minutes or something like that on average with their patient. I mean, there's no way in hell you're going to get to what the core issue is in 10 minutes. And therefore it's a pharmaceutical game. It's a symptom alleviation game as opposed to a core root cause game. And that's where I think it's leading to, higher utilization. I saw something the other day. You probably know the stats better than me, but 70% of people entering Medicare has a chronic condition. 15% of people in Medicare have 6+ chronic conditions. I mean, that's the challenge that we're dealing with as a result of 50 years of being on health insurance that don't educate their members on how to be healthy. And their members don't really have any incentive to be healthy because somebody else is paying the bill.
Yeah, great point about the physicians. Have you been getting feedback from the physicians that are interacting with your members regarding, that aspect of it?
So much. And we have dozens of physicians reaching out to us every month being like, please, will you send us more people? Like, we want to we want to rid ourselves of the health insurance middleman, and we will take way less if people will pay in cash, because I don't have all the bureaucracy of billing. I saw some survey maybe 2 or 3 months ago where doctors spend 15 and a half hours a week, I guess almost 2 days a week, dealing with health insurance plans. Like, what would happen if we gave them 2 days of their week back to go do what they're really good at, which is caring for human beings, as opposed to fighting with health insurance plans for pre-authorizations and non-billing and all this kind of crap. So I think, paying in cash, paying direct at the point of care alleviate so many of these issues that we're seeing in healthcare. And we're seeing it directly. I mean, we're just, like I said, we have doctors calling us all the time being like, please send us more people.
Okay, this is where I want to jump in because I'm very excited about this. I recently changed insurance companies for my car, and they sent me this little device that plugs into the data port on the car. And it basically just tracks behavior behind the wheel. And So they actually know how I drive because they've got the data. And if I drive better, guess what happens? I pay less. Why? I'm a lower risk. This isn't rocket science. And I've often wondered what in the world is going on with health insurance that there's so little incentive for people to not use health insurance. And I think I actually know the answer, but it seems like you've been going in that direction too with something else. Well, I'm
Yeah, I
setting
mean,
the table here for you, Andy.
yeah, I mean, I think from my perspective, it's regulation right now. It's the government getting involved in some of this. And they say you can't actually price health insurance differently if you are 400 pounds versus if you're 180 pounds. You can't price it differently if you're metabolically healthy versus being metabolically unhealthy. And so, therefore, me, who's metabolically healthy per Dr. Ovadia's book, I've checked off all the check marks, make sure I've got enough of my visceral fat and waistline and all that kind of stuff. I'm paying for the people who are unhealthy. I mean, 25 cents of every dollar goes to people with diabetes. And so, and type 2 diabetes, as I think the three of us would agree, is reversible. And so we're paying for lifestyle choices for people who aren't making very good lifestyle choices. And so what we want to do is get together a group of people that says, look, if you're paying for health insurance, you're paying too much because you're subsidizing all of these people who are making very bad lifestyle choices. And so we've got a group of people who've come together that are, for the most part, metabolically healthy. I mean, I know BMI is not a perfect, kind of metric, but it's 5 points below the national average on BMI. If you're obese, we don't allow you into the community. But we also, give benefits to those people who can show us that they are metabolically healthy. So starting in March, so in just a few weeks here, we're going to give discounts to people who can show us that they're metabolically healthy. And now we're starting with visceral fat via a DEXA scan. And we're starting with fasting insulin, which is an easy one to get with your blood test, which are pretty darn good proxies of metabolic health. Not perfect, but pretty darn good. We'll be adding VO2 max probably by the end of the year so that you can submit a VO2 max that's in the top 25%. We think that's a great longevity parameter. I also want to get something in there for people who, think like I do, that muscle mass is a key indicator of longevity as well. So I haven't decided if it's, squatting, 1.75 times your body weight or a certain number of pull-ups or something like that you can prove to us. If you can do that, it shows you have, sufficient muscle mass. Those are types of things that we're thinking about. And you're actually going to be able to get a, 20% discount off of CrowdHealth, which is already a 50% discount off of what you're paying for health insurance. And, hopefully this not only awards people who are healthy, but I think more importantly, incentivizes people to actually take a look at their metabolic health and understand how important it is. And if the 20%, which, for a family is, $150 a month, is hopefully enough to incentivize people to really take a good look at this.
I would argue that a big part of the problem with the current healthcare situation is exactly what you described just now, is incentives. Human beings respond to incentives. Anybody who's ever had a kid and tried to raise a child understands people respond to incentives. And there is no incentive in our healthcare system to do anything other than try not to pay it. There's nothing done. There are no incentives for being healthy.
On the insurance side of things,
on the insurance side, there's no incentive. You're gonna get raped on your insurance payment, regardless of how you live, regardless of the health choices you make. And people respond to those kind of incentives. It's really not complicated. Okay, I gotta get off my high horse. I'm ranting. I realize that.
No, I mean, it's interesting to look at other insurance areas, right? And, for instance, right, I live in Florida, right? And the area I live in Florida, got hit by, 2 hurricanes and other storms. And, the homeowners insurance companies are all like, okay, we got to raise your rates. Now, obviously, I can't control, hurricanes. You can say I can choose whether or not to live in that area of Florida. And, maybe that's an argument. But, I'm being penalized in that insurance model for things that I truly have no control over. And, on the healthcare side of things, we have sort of the exact opposite, right? I mean, essentially, I'm being penalized within the traditional insurance model by having to pay more for what other people are doing. And, one of the things that strikes me about the way that the insurance system has now evolved, again, this sort of goes back to the disconnection. And when the government said you can't penalize people for being unhealthy, it sort of sends a message to people, your health is something that's outside of your control. So we're not going to penalize you for it. And I think that largely has become a sort of subliminal messaging within the healthcare system that, we aren't in control of our health. We as individuals, diseases happen, it's genetic, everyone gets sick. So, don't even bother. And instead, we're going to set up this system that it's not going to cost you things in the end.
I don't even think it's subliminal. I think it's explicit. I mean, I think that you're hearing people, especially in DC, especially, in the last administration, basically saying these people who are overweight, they can't help it. Like they can't do anything about it. It's a disease. And, we should just, put them on GLP-1s and let them continue to do what they're doing. And so I think they're a little bit more explicit in saying you can't help what how your body reacts to, these lifestyle choices, And okay, one of the things I wanted to say, because Jack, I think something you said brought this to mind is, these incentives, whether or not you like Charlie Munger, he's a smart dude, and one of the things he said is show me the incentive and I'll show you the outcome. And, and so it's pretty clear. But one of the things that I think is interesting about what we're doing is, if you're going and utilizing healthcare and this big megacorp is the one that you're hurting, nobody cares. Like nobody cares if UnitedHealthcare, especially UnitedHealthcare. And in fact, they actually want to hurt UnitedHealthcare because UnitedHealthcare has hurt them so bad, so many times over and over again. The thing that we've done is we've created a community of like-minded people. So we've got a Bitcoin community, which are all just Bitcoiners, right? It's their Bitcoin tribe. And so we actually have people being like, you know what? I'm going to actually think about the way that I utilize healthcare because I'm not screwing UnitedHealthcare. I'm screwing other people in my tribe. And we've have dozens of examples where people will reach out and be like, please, can you find me, a lower cost option because I don't want to screw the crowd. Like the number of times I've heard that I don't want to screw the crowd or I don't want to, hurt the crowd or whatever has been over and over again. And so you get a tribe of people, same worldview, they help each other and hurt each other as a group. And therefore that changes behavior, that changes utilization. And in fact, the way that we work is we're only asking for the amount that month that we need. So for an individual, we're only going to ask you up to 140. And if the crowd does really well, we're going to ask you for less. And so the crowd goes, it flexes up and down depending on how your community is doing. And so there's a little bit of a social pressure here too, to make sure you're doing well so the community does well. So this month we didn't ask for 140, we asked for only 80 of the 140. The remaining 60 are our community members, they get to stick back in their pocket. Or if you're a family member, you get to stick an extra $180 in your pocket this month because the community is doing so well. I think it's the same thing with the government. I don't give two shits if the government, has to pay for extra healthcare costs. It doesn't impact me directly, but if you get in this tight community, there is a direct relationship between what you're paying and how the community is doing. And so there's just this weird psychological thing that's happening with the community where people are actually changing their habits, which is super, super cool.
But it's not weird psychology. It's how humans behave. I can remember when Obamacare was being debated and they came out and said we have to pass the law before we can read it. And, I knew in that instant, I knew this is going to be a massive, gigantic train wreck because human beings respond to incentives there were for everybody involved in making money as a result of the government passing a law that's you've got to pay for something, was all on the side of the people who get paid and not on the side of the people doing the paying. It was obvious. It was blindingly obvious. And that's not just when we're not merely motivated by finance as human beings. We're motivated by a lot of things. And you're just tapping into the social motivation. You're tapping into the desire to be perceived as a contributing member of your tribe. I think that's astonishingly wise. Okay.
And I think the other thing I'm doing too is one of the issues when somebody else is paying the bill is you don't care about the price.
Yep.
And ultimately our members are paying the bill, but we have a community that's helping them pay the bill. And yes, while they are directly paying the bill, they have a community that's helping and pitching in. But one of the things that's interesting for us is when you submit a bill to the community, we will actually rate that bill based upon the price. So if you go and get a $3,500 colonoscopy, and we know you can get a $1,200 colonoscopy in your area, we let the community know that. And so what that creates then is an incentive for people to actually do some shopping for their healthcare expenses. And so we don't ask them, they don't have to do it themselves. They can call us because we have this tons of data about what colonoscopies cost, or what knee replacements cost, or what ACL, tear, reconstruction cost. And that gets people to call us to say, hey, do you know a really good price for a colonoscopy in Austin, Texas? And we'd be like, oh yeah, here's 4 doctors who will do it for, $800 to $1,200. And so again, that drops, puts pressure on prices, because right now, as you guys know, every player within healthcare, including the health insurance companies, want prices to go up, and so when people are like, I don't understand healthcare, it's so complex. I'm like, look, the hospital systems, the sellers of healthcare want the prices to go up. The buyers of healthcare, the health insurance plans, actually want the prices to go up. So you don't need a PhD in economics to know if the buyer and the seller want the price to go up. Guess what's going to happen? The price is going to go up. And so there's no counteracting force to push these prices down. And so that's what we're doing, is just trying to push these prices down by people actually engaging with us prior to going and getting some of these big procedures. And in essence, what's happening is we're finding them prices that are about 50% less than UnitedHealthcare, which is the 7th largest company by revenue on the planet. They can negotiate better for these prices than UnitedHealthcare can. So we're literally getting about 130, 140% of Medicare for most of our procedures. United is paying somewhere between 250 and 300. And, our individual members are able to do that.
The 7th largest company by revenue on the planet does not do a better job of negotiating prices than your little crowd-funded CrowdHealth company in Austin, Texas.
Now,
because they have no incentive to.
Yeah, talk about this is a nuance that I think people don't understand about, insurance as it relates to the healthcare system. Because logic would say, okay, if UnitedHealthcare is on the, is responsible for paying for all this care that's being delivered, they would want that care to be delivered at as low a price as possible. But talk about why that isn't actually their goal.
Yeah. So if you think about it, let's just take a health plan. I'm gonna use easy round numbers just to make the math easy. Let's just say a health plan is pulling in $100 million worth of premiums, every year. Okay. There's a law that says they can only use 15 million of that for non-medical services. So that means all their administrative costs and their profit. Okay. So how do they get that 15 million, grow at 10%, right, to 16.5 million? Their premiums have to go from 100 million to 110 million. So they actually want premiums to go up over time. So they have more to, pay their executives and make profit and all those kinds of things. And I think that's an interesting point. But if you think about it going the other way, right, what if their premiums went from 100 million to 90 million? So they're what they can use goes from 15 million to, if I'm doing the math right, 13.5 million. That means they have to cut staff. They can't have their big broker parties in Maui. Their salaries have got to go down. Something has got to get cut. if your premiums go down. It's really hard to do that. And so they do not want to see premiums go down. So again, that's why health insurance plans want to see premiums go up over time as opposed to go down over time. And so you're actually screwed in two different ways. Over the long term, they want prices to go up, but they're then trying to keep that 15% at 15 because they don't want it to go to 14%. Like they don't want the cost of medical to go from 85 to 86%. And so once it starts getting to the 85% level, they literally have a dial. This just came out. Cigna, has this little dial that they dial up how hard it is to get a pre-authorization or dial it down depending upon where they're at on their medical loss ratio for the year. So you're screwed in year two because they're trying to, manage around that, maximizing their profits in year. So you're really screwed both ways. And all the incentives are completely perverse. And so that's why I was saying the health insurance plans want the prices to go up. I mean, that's screwed up part of our system. I mean, we have a principal agent problem, right? If you talk about economics, they're supposed to be our principal or their agent. Our agent is supposed to go out and try to get us the best deal. But in fact, what's happening is our agent is looking for the worst deal. And we're the principals and we're the ones getting screwed.
Yeah, it's amazing. And it actually gets even more perverse because, obviously the two biggest sources of spend are going to the hospital and pharmaceuticals. And largely the insurance companies have started to buy up that business. They own the hospitals. They own these things called PBMs, which are the distributors for the pharmaceuticals. And, a lot of what they're paying more for, they're actually paying to themselves. And it makes it, even harder. I mean, I may have said this the first time you said we had you on. I've said it many times on this podcast. The current healthcare system works great for everyone except the patients and the doctors. Yeah. Everyone else is pretty happy with the system. And that's why, an idea such as yours, which no offense, kind of simple and just makes sense. And no one has any incentive to enact it because, they don't want to change the current system in any way. But yeah, it really is amazing.
And when you talk about that real quick, Dr. V, like only 8% of our medical spend is going to doctors. Yeah, everybody's the doctors don't get paid. They get paid enough. These guys are making, millions of dollars, hundreds. It's like, no, it's 8%. You could cut the salaries of the doctors in half and you would only get 4% back. And by the way, all the doctors would leave and do something else.
I think they just send that 4% to the administrative folks.
Probably.
Well, yeah.
I really don't think.
And the other thing about the doctors is they're not really in control of what they're charging. People get pissed off. They go to the doctor, right? And they see this bill that gets generated by the doctor's office for, $8,000 for a 15-minute procedure, like you said. And let's be clear, the majority of that 8,000 wasn't going to the doctor. It was going to the surgery center and all of this. But even if it was, right, the only reason doctors charge what they charge is because they know the insurance company is only going to pay them 10% of what they charge or 15% of what they charge. So they have to.
I think 1,000 of the 8 was for the doc and for the anesthesiologist because she had to go under. So it was like 1,000 of the 8,000 was going to the doctors and 7,000 went to the facility.
And again, the doctor's assumption is that $1,000 they were only going to get a couple of $100 for, in the end, because the insurance company, those are the way the contracts are written with the insurance companies that you only get X% of what you charge. So it's just an amazing. So, let's circle back. Let's hear about some of the success stories from this, within this model, because, I'm sure a lot of people are thinking, this sounds like a great model if I don't need to spend money on my health, but what happens if I actually get sick or, get into an accident?
Yeah. Yeah. I mean, the one I mentioned earlier is a fun one because it's got a happy ending, but, we had a member, funny enough, most of our crowdfunding goes to 2 areas and I call them the bumps, the baby bumps and the bumps and bruises associated with being active and outdoors and doing your thing. So those are the 2 primaries. Actually, I think it was like 73% last month go between those 2 things. And then the rest is illness and wellness and other stuff. But so anyway, one of our members was up in Montana. He was in bear country, wolf country. And so he had a 44 in his holster in his chest. and he was out fishing. He hooked into one, was reeling it in. He leaned down to pick up the fish. The 44 fell out of his holster, hit the hammer perfectly, and went into his calf, out the back of his calf, into his thigh, out the top of his thigh, into his chest, and then out the back. He said he looked down and there was green stuff coming from his chest. So I guess it was bile from his something. I think it took out his small intestine, nicked his liver, took out his gallbladder, like all kinds of stuff. He had to fly a helicopter in to pick him up because he was 2 hours away from the closest hospital. Got to the hospital, went into a coma for multiple days, finally got out of that hospital. They wouldn't allow him to fly home because of some of his injuries. So he had to drive home. On his way home, he went into sepsis. And so he had to stop, go into the local hospital. He was in sepsis for 3 weeks at the local hospital. And this ultimately ended up being a close to $1 million bill. We were able to negotiate that bill to about $200,000 with our negotiation. And so that got funded, almost immediately by the community. And, he's off to the races. Praise God. He's doing well. And we're actually going to fly up to Montana this summer to reenact it for a little mini documentary called The Big One. It's like he caught the big fish, but he also, everybody's worried about the big one with CrowdHealth. What happens, And so it was a great story, and he's a legend, in CrowdHealth now for that. And that was an interesting one. Another one that I think just kind of like highlights the craziness of our system. We had a guy who's lifting weights. He was at the gym, and his heart rate spiked to somewhere between 230 and 240. And so he went into the ER, and they're like, you have SVT, supraventricular tachycardia. I'm sure Dr. Ovadia has seen this many times. And they're like, yeah, you have to do this procedure, go in and do something with the heart, burn part of it or something like that. And it's going to be $86,000 to do this procedure. This is a fairly, from what I understand, common procedure. It is, it doesn't take too long. It's not like it's an 8-hour surgery. It's a couple hours, I think. And so we were like, $86,000. Hold on a second. Can we actually take a look and see what else is around? He was in Wisconsin, which is one of the most, expensive places on the planet to get healthcare due to con laws and consolidation of hospital systems and all kinds of stuff we can talk about if you want. But we found him a place in Chicago that would do it, which was 90 miles away, that would do it for $44,000. So 90 miles, $44,000. And then we found a guy in Oklahoma City who's done almost more of these than anybody else in the country. And he was willing to do it for $22,000. So the difference between Oklahoma City and Wisconsin, 1,000 miles away, is, $65,000. And so we called the guy and I said, listen, we'll put you on 2 first-class tickets, you and your wife. We'll pay you $2,000. We'll put you in the penthouse hotel in or penthouse suite in the nicest hotel in Oklahoma City. We'll fly somebody to be your concierge for the week. We'll pick you up at the airport. We'll drop you off. We'll pay for all your food. And, still the community saved something like $58,000 or $57,000 or something like that by just going 1,000 miles to go and get this thing done. And I think he needed like 1 day to make sure that everything was fine. And then he flew home the next day or something. So it was like a 2 or 3 day type of thing. It wasn't that big of a deal, but this just shows you like how asymmetric, our pricing is within healthcare. If you can go 1,000 miles and get something for, what ended up being $65,000 less than where it is in your local area, right? Imagine buying a car, right? If you could buy a car and, you would go that and save $5,000, to go 1,000 miles. Yet again, healthcare, nobody cares, nobody shops, nobody's going to do that. But this specific person was one of those people who's like, look, I want to do right by the community. And so I'm willing to go and do it. And we paid him for his time. So that helped. But we are able to do some of those things because we're just not structured the same way as a health insurance company. And they felt like they were king and queen. Like they thought this was the coolest thing ever, that we would cater to them so well. And we don't ask people to travel all the time, but when prices are that different, we typically can find a deal where they are willing to do it for some of these procedures that are not, incredibly, I wouldn't do an open heart surgery and do that. But, some of these surgeries that are pretty run of the mill type of thing. Those are a couple interesting stories that we've had, over the last couple of years, but they've both resulted in massive savings for our members.
And what are some of the tools you're leveraging to do that. You mentioned about the car, and when you're buying a new car, now it's actually pretty easy. You can get on the internet and you can kind of shop around. And yeah, if you find someplace a couple of 100 miles away that, will save you a couple of grand on the car, and, you drive or whatever, or fly and go get the car and come back. I think people are doing that increasingly because they can. But that guy sitting, in Wisconsin, right? There's no way for him to get on the internet and say, okay, how do I get this procedure done at a lower cost? Regardless of the incentive for him to do it or not. So what kind of tools are you guys, how do you do that you can shop around and find these costs when it seems no one else can in the healthcare system?
Yeah, I mean, I think a couple of things. One is, as you know, surgery centers are significantly less expensive than hospitals. And so we went around to about 100 surgery centers and collected all of their prices. Sometimes they have it online. Sometimes you have to call them and say, here's the top 20 things we're looking for. What prices do you have for those top 20 procedures? So we've got a pricing list. And then I think, even bigger source of data now that we've got, 10,000 people who are using CrowdHealth over 20 or 25,000 bills, is we're starting to collect data from our members who are going to these local places. They're getting prices. We can put that in our database. We always measure it compared to Medicare just to make sure that we're not paying 300 or 400% of Medicare. Like, they're actually good prices. And so this database is growing over time, which is an asset that nobody else is going to have. So in essence, what we're going to do is we're going to have a marketplace of cash pay prices that are 50% less than what your health insurance plan pays. And our members are going to have access to them. And in most major metropolitan areas, those top 20 or 30 procedures, we know what they cost. We know who's willing to do it for those costs. And, if you're in, Des Moines, Iowa, we may not have it, but then we also have a team of people internally who will call everybody in Des Moines, Iowa, every orthopedic surgeon in Des Moines, Iowa for your torn Achilles or whatever, and get the best price. And so once we have that price, that goes into our database. And so this database scales as our members, grow. And that's what I think is going to be our golden asset, is having that database for people to access. So it's worked really well. And there's very few places where we don't have, some kind of insight into what's going on. Now, there are some places that we just can't get great pricing because of the market dynamics in that area. Wisconsin is a really hard one. The Pacific Northwest is really hard because of consolidation of these hospital systems and a monopolistic, or at least an oligopolistic behavior that they're, doing based on with these healthcare prices. Some are not as well as other. The western slopes of Colorado is another one. If you get hurt in Aspen, you're screwed. It's just there's only one hospital in Aspen and one orthopedic surgeon and one ENT, and you're just going to get screwed on prices there. So you just got to realize that it's a bit based upon where you are in the country. But most of the time, we can get people to really low cost but really good, surgeons and docs all over the country.
Wow. Yeah, pretty cool stuff. What do you?
We had a member in Austin. Just one other quick one, just real quick. We had a member in Austin who tore her ACL, went to the hospital, and what these hospitals do, of course, is they then refer them out to the hospital system's orthopedic surgeon. And so they went to the hospital system's orthopedic surgeon, and they said, "Yeah, is this $24,000?" Of course, they're going to do it in their hospital, so they get all of those fees. She calls us. She's like, "What am I to do?" We knew there's an orthopedic surgeon in town who does it at a surgery center. This orthopedic surgeon also does many of the joints for the University of Texas athletic program. So we know he's really good. And they got it done for $11,000. So we went from $24,000 to $11,000 by just making one phone call to a better orthopedic surgeon. And those are the types of data points that we're getting now all over the country, and has allowed us to get our members to basically, direct our members or navigate our members to really good but low cost docs. And the one thing that people don't understand in healthcare is the doc who charges the most oftentimes is not the best doc. If there's an orthopedic surgeon that sticks to these knees every day, he's going to be way better, way more efficient, way less, issues after the fact than the guy who does 6 of these a month or 6 of these a year. And so they can do it and just knock out knees and shoulders all day long really well for a really low cost. And they're the best in the city of doing it. So that's something the hurdle we have to get people over, is saying, oh, it's not like the Four Seasons versus the Courtyard. It's actually the inverse of that. The guy that's making 1,000 widgets every day on the line, right? As the widgets go by, they're going to be much better at it, and it's going to be way lower cost than the person who needs to produce one widget every 2 days or something like that, right? People just don't understand that, but that's very relevant within healthcare.
Yeah, and I think ultimately, again, getting back to the physician view of this, right? If you can create a marketplace that allows doctors to, innovate, be entrepreneurial, be, again, decide what they actually need or want to charge for these things, I think you can solve a lot of the issues, right? It's not that doctors don't want to do this, it's that they can't because they don't have control of the system anymore.
Yeah.
So I think, you're definitely attracting physicians who want to fit into this model by delivering, high quality, cost effective care that, allows everyone to, I guess you could say profit, right? I mean, doctors still need to make a living, but they'd much rather do it this way, I think, than, just being at the kind of behest of the insurance companies.
If we could help doctors have viable independent practices, that would be an incredible goal, an incredible mission. Because, as Dr. Wade, as you know, right, a lot of these doctors have their own independent practices, and these health insurance companies like crush them, or 50% of your business is coming from United, and United can be like, yeah, we're going to pay you 30% less this year, and you can't do anything about it. And so then you have to sell to the hospital system, and now you're just an employee of the hospital system. And so that pendulum has swung that way, where most of these doctors are a part of these hospital systems. And so we're trying to get people, and the vast majority of the time, we're sending people to independent doctors. They have their own practices. They have control over what the price is. They don't have the big infrastructure charges that they have, the big hospital systems have. And so they can charge a lot less. And so we're trying to support those independent docs because, we want them to survive. If all the independent docs get swallowed up by these big hospital systems, that's really bad for our business because we can get much lower prices with these independent docs, and the docs make as much or more, even though it's half the price because the hospital system isn't taking a huge chunk of it.
Oh, good God. Yeah. The numbers you just quoted earlier were like the doctor is taking maybe 12.5% of the bill is actually
That's right.
going
That's
to
about
the
right.
person who is delivering the care.
Yeah. It's
I
probably
mean,
even less than that.
when you look at certainly, when we're talking about procedures and hospitals, but even, even your family, practice doctor in his office, a lot of his overhead is going towards getting paid by these insurance companies, right? It's not as easy as, send the bill to the insurance and it gets, and you get paid. It's a massive amount of infrastructure to make sure your notes are structured the right way and the codes are proper on the bill. And then, fighting with them to get it approved oftentimes. And, I know many doctors that are in independent practice, family practice doctors, and 40, 50, 60% of their overhead is just dealing with the insurance company. So you cut out the insurance company, and instead of I can just have, one of Andy's members walk in and say, hey, we'll pay you cash, and, you can, you can do it for a lot less, still make your, profit margin. And because you've cut out all of this overhead that's just waste within the system in the end. It's not even that the insurance company is capturing that money. It's just really wasted money within the system.
It's just the payment friction. Yeah. It's payment friction that doesn't add any value to anyone.
Yeah, exactly. Before we wrap up, I'd love to kind of get your perspective on, obviously there's a lot of chatter now and focus within the new administration on healthcare. And, a lot of that is around trying to make people healthier, which we know you're aligned with. But maybe talk about what you're hearing, what you're seeing, or what you want to see happen, on the kind of insurance aspect of this.
Yeah, I mean, I think that one of the things actually we're not doing well is finding doctors who have a similar worldview as you do, Dr. Ovadia, just in terms of metabolic health. It feels like metabolic health is not even a concept that most of the doctors understand, whether it be primary care docs or cardiologists or whatever. And we've had a really hard time finding doctors who have the same worldview, and we're trying to build that database, and it's hard. It's hard to find these people. And I'm hoping through, the MAHA movement, we start getting at least a little bit of education around what does metabolic health mean? How important is it? I know, Callie and Casey Means have been making the rounds, and I know that Callie is very involved with the RFK, kind of a presidential thing and now HHS thing. And so I'm hoping there's some efforts there to get metabolic health at the top of the conversation. I will tell you, though, that I see, and I don't know what you guys are seeing, my family is starting to talk about it. My extended family is starting to talk about metabolic health, and they are not the type of people that you would think would start. These are middle of the country, Midwest, type people who you just wouldn't consider them talking about. But they're starting to talk about it. They're starting to ask questions. They're starting to ask questions about cholesterol. What's the difference between LDL and HDL? And some of these questions, I think, are really great starting points. And while they're still kind of kindergarten level, metabolic health questions, I think people are starting to think about some of, their health a little bit more deeply. And so that's what I'm hopeful for, is at a minimum, let's start getting people to think about this, get interested in this, and hoping we can start educating them. And I'm hoping your book will fly off the shelves if people are starting to, really get interested in what does metabolic health mean. And, what are the metrics to decide whether or not I'm metabolically healthy? I think the number you used was 88% or something like that of us are not metabolically healthy. And so that's what my biggest hope is. There's some legislative things, there's some policy things here too. I'm hoping HSAs get bifurcated from high deductible health plans. All my members are uninsured. I'm uninsured. I'd love to be able to, put my money in an HSA. I'd love to get those tax benefits. I can't because I'm not in a high deductible health plan. I'd love to see that. I'd like to see some bifurcation between the employer and the employee. I don't think employers have anything to do with our healthcare. They shouldn't. This is, as a relic of World War II, post-World War II, policy decisions. I'd like to see that happen. I'm not sure it's going to be totally bifurcated, but at least if you can start cutting the strings between the two and make some progress there. For our business, this is a selfish thing, but the subsidies, the ACA subsidies are up this year. And these are, were introduced in COVID to help people with their bills and has gotten extended once. And as you know, once you give something to somebody, it's hard to take it back. But I don't think this current administration is going to allow those to extend, which means 15 million more people are in my, kind of category that I can go after. So I'd like to get people off of those ACA plans and on to something like this where we actually, take better care of them. And so that's, a bit of a selfish thing that I'm hoping for. But I do think it's something that's going to happen is a lot of these subsidies are going to go away. My brother, for example, who's probably worth a couple $1,000,000, is paying $0 every year for his, Obamacare plan because he's got a subsidy because he doesn't have a W-2. I'm like, that's screwed up. I love you and I'm glad for you, but I don't want my money going to people who can clearly pay for this. So there was something very screwed up with that system. And I think through the Doge and some of these things that we're talking about, like that, those types of things are not going to be, palatable anymore to this administration. At least I hope not.
Yeah. Great.
I can say this. Since the last time we talked to you, I mean, I can see it here from my little office in my backyard in Phoenix, Arizona. And I know Phil sees it where he's going. Lots more people are aware of what it means to be metabolically healthy than just 2 years ago. Although we've all been in it for what feels like forever, the vast majority of the population is just now starting to be aware of it. It's new for them. We're making a difference, and you're a big part of that, Andy.
I think you guys are a big part of it. I mean, there's no doubt in my mind that thousands or hundreds of thousands of people are better off as a result of the things you guys are talking about. And so I'm just so appreciative of what you all have done. I know that it's probably not the most popular thing to talk about, is talking about your metabolic health, but it's really having an impact. I know your book had an impact on me and how I think about things. I think I wrote you a couple times afterwards. What about this? What about this? I was trying to get a little bit of a free advice, but I really truly believe you guys are doing something special. And so I'm very appreciative. And we'll probably do another round of your book here in the next couple of months to get that in front of some of our new members. I mean, we grew, I think the last time we talked, I think we had 2,000 or 3,000 people, maybe 4,000, and now we're at 10,000, and we'll have 25,000 by the end of the year. So,
I was going to say, you're probably hitting the hockey stick here pretty soon if you haven't.
It's hockey sticking. It's hockey sticking. So
yeah.
we got a lot of good, we have a lot more people we have to give some books to.
Sounds good. It's great. It's great catching up and hearing, how well this has been progressing. I think like I said, it really just makes sense. And so I think it will be attractive to more and more people as, they get forced to really look at what's happening. And, that's one of the things that it gets me excited about, what's happening now in our country is at least these things are getting exposed and getting talked about. Yeah. And, and then people can make up their own mind, which way they want to go, but at least they have a different type of option. Just tell people how they find CrowdHealth and, where they can maybe follow you on social media and stuff.
Yeah, joincrowdhealth.com is our main website. And if you go to, we're most actively on X, which is also Join Crowd Health. And in fact, right now we're doing our quarterly quarter cow contest. So somebody who retweets our quarterly quarter cow contest tweet gets a quarter of a cow delivered directly to their home. Come and join us and have your chance of getting a quarter of a cow. We appreciate it.
Awesome.
I love the name too, the quarterly quarter cow.
Quarterly, alliteration is going to save the world for sure.
And metabolic health. All right.
And there you go.
Our guest has been Andy Schoonover of CrowdHealth. Join crowdhealth.com. Thanks for being with us, Andy. Look forward to talking to you next time, which will be, I suspect you're going to be much better known even than you are now. This has been Stay Off My Operating Table with Dr. Philip Ovadia. Thanks for joining us. We'll talk to you next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.